We did talk about blood glucose, the normal fasting range. This is widely accepted, 70 to 110 mg per deciliter. All right, so then we remember that prefix hypo, that means below and under. And then what we have here is hypoglycemia. So when you have hypoglycemia, that means you're fasting, but now your blood glucose has dipped below 70. So this is low blood sugar. So your blood glucose levels is below 70 mg per deciliter. Now hyperglycemia is when you have this above normal range. You have high blood sugar. So blood glucose over 110. So again, these are widely accepted values. You should definitely know these. Now hypoglycemia symptoms, so fatigue, pale skin, shakiness. So again, this is, if you've known anyone has hypoglycemia, like actually once I had a hypoglycemic episode, I didn't know what was happening too, because it was the only time in my life I've ever had hypoglycemia, and yeah, I think it was because I was doing keto but irresponsibly. But I'm still scared of doing keto now. But I was funny, I was talking to a student who had type 1 diabetes, and yeah, you feel drunk. It feels like your whole world's melting. Like you're like, whoa, kind of, you feel like it's, yeah, you know something's wrong, but you just feel totally discombobulated. So yeah, hypoglycemia, sweating, hunger. So you feel all of these things. You just feel like, yeah, you don't know what's going on. It's almost kind of like having a panic attack, supposedly. But not, they're not the same thing though. So how do you cure hypoglycemia? Yeah, what they did is like, okay, they saw my blood sugar was 40, they just gave me a juice box. I felt fine. Yeah, so yeah, it's not a fun drunk either. So it's scary when you have a hypoglycemic attack. It's like it's so confusing, and you're like, wait, especially if you've never had hypoglycemia. So hyperglycemia, so this is over 110. So hypo is below 70 and then mg per deciliter. Hyper is above 110. So what we see with hyperglycemia, polyuria. So again, poly means many, and urea, well, sounds like urine, right? So many urine, increased urination. So what makes urine? Your kidneys. So what we have here is all this hyperglycemia. You're going to have above normal levels of blood glucose. Now what we have here is that we have water. Yeah, so water is going to be attracted to this. Why? Well, remember that O word, osmosis? So when you have something that's very concentrated in terms of sugar, and another solution that doesn't have as much sugar, which way will the water go? It'll go to the solution that has more sugar, right? And then so all this water now into the bloodstream being absorbed via osmosis is going to go to the kidneys, and the kidneys is now dealing with excess water. What is the kidneys going to do with this excess water? Well, remember, your body likes homeostasis. It likes maintaining a certain level of hydration, solutes, and everything. So it's also going to dump some of the sugar into urine, but also dump water into the urine as well. So this is why you're going to have the kidneys trying to balance your sugar and your water balance in your body by secreting the glucose into your urine. So this is what we call glycosyria, abnormally high glucose in urine. And this is why diabetes is something that I think even the ancient Greeks knew about it. Like what they noticed is that people who had diabetes mellitus, when they urinate, well, what was attracted to sweet urine? They would find things like ants were attracted to sweet urine, and that's how they used to diagnose it back in the day. They would say like, okay, there was like primitive urinalysis. They would have them see whether ants were attracted to a urine sample from someone who they thought had diabetes. And then, yep, so all this water is going to go out as well. So that with the sugar as well, you're going to have all the water leaving via the urine. Because why? Increase urination. So you're also going to have polydipsia, or increased thirst. So that's common symptoms of uncontrolled diabetes mellitus. Increased thirst, increased urination, and presence of sugar in urine. And actually, I know this might be a little off-putting for some people, but if you've been around diabetic patients enough, diabetic urine does kind of have an odor to it as well. Yeah, and things like other things that are affected by hyperglycemia, blurred vision, fatigue, and headaches as well. So this is why it's important to keep it, that you can't have, even though your blood sugar does spike, you want it to return to normal levels, because again, too little blood sugar, you're going to have hypoglycemia. Too much blood sugar, you're going to have hyperglycemia. And yeah, it does have a sickly sweet smell. Like, it's kind of like when that's like the curse of knowledge. When I go to like when I have to use a public restroom or go to the park and use the restroom, I'm like, oh, someone with diabetes used this urinal. But it does have a distinct odor with someone who has uncontrolled diabetes and glycosyria. All right, so ended on time, and yeah, we definitely don't have time for diabetes mellitus, but that's why I kind of give insulin, glucagon, and diabetes. That's why I give diabetes its own lecture, because it's something you definitely need to know the basics, but it involves a lot of that signaling as well.